Hi everyone, welcome to my channel Capsa. Today's topic is about Wolff-Parkinson-White syndrome or WPW syndrome. So in 1930s, Louis Wolff, Sir John Parkinson, Paul Dubé-White, these three scientists published an article where they described about this syndrome. It is a pre-excitation congenital syndrome. Pre-excitation means earlier activation of the ventricles. Congenital means present at the birth or inherited kind of syndrome. And this syndrome inherited as autosomal dominant trait. Okay, and recently described with locus mapped to the chromosome 7q33, this chromosome. It is more common in men than women. Now you will understand WPW syndrome through a picture. So this picture represents WPW syndrome. So in this syndrome, an extra or accessory pathway is present along with the normal pathway. And when impulse travels through the extra pathways as well as the normal pathways very quickly, causing the heart to beat unusually fast or causes tachycardia. Now the question is, which type of tachycardia it shows? It shows reentry tachycardia and the position is supraventricular. Supra means the re-entry occurs in here. Supra means upper ventricular. It means upper part of the ventricle. The re-entry occurs. So that's why supraventricular re-entry. Now re-entry actually when impulse travels around the heart in a circular pattern. Which kind of? Look this picture. This is local re-entry. You can see here the bundle of Kent or the accessory pathway also known as bundle of Kent. So this accessory pathway also known as bundle of Kent. Why? Because description of this pathway was reported by Stanley Kent in 1893. And interesting fact is this accessory pathway shows two kind of properties. First one is it can conduct impulse faster than normal. Second one is it can conduct impulse in both direction. That's why it shows the re-entry. Clear? Now what are the types? So it is of two types, type A and B. Type A is premature activation occurs in left ventricle. It means when the left accessory pathway are involved. And if the right ventricles or the right accessory pathway is involved, that is type B. Okay. So in this picture you can see P, Q, R, S, T wave. But there is a slurred upstroke of QRS complex which forms delta wave. So if there is a positive delta wave, it shows type A WPW syndrome. In case of type B WPW syndrome, it shows negative delta wave. Clear? Now what are the symptoms? So first one is heart palpitations. Heart palpitations means it's a kind of feeling of having fast heartbeat. Second one is rapid heart rate. Third one is dizziness, lightheadedness. Dizziness, lightheadedness means you feel disoriented or you may feel like the world around you is spinning like this. Fourth one is fatigue and anxiety. Fifth one is cardiac arrest, though it is rare. Okay. Now, what are the diagnoses? So, the first diagnosis is through the electrocardiogram. Mind it, electrocardiograph is a instrument. Electrocardiogram represents the recording, but electrocardiography represents the procedure. Okay. Second one is Holter monitor or event monitoring procedure. Third diagnostic procedure is exercise testing, also known as CPET or cardiopulmonary exercise testing. Fourth one is electrophysiology testing. So this testing is also known as cardiac ablation. Obviously, this kind of surgery, cardiac ablation, is done to test your electrophysiological findings. Okay. So the first is electrocardiogram. Based on the electrocardiogram, you can see it is a delta wave, and this is a PR interval in normal case. This is a PR interval and QRS interval. In case of WPW syndrome, what happens? This PR interval becomes shortened and the QRS complex become wide. So as a mnemonics, we can remember WPW as W stands for wide QRS complex. Wide QRS complex, you can see here. P stands for PR interval. Which type of? Shorter. So shorter PR interval. And this W stands for wave. Which type of wave? Delta wave. So that's a mnemonics, and along with this it will shows the normal P wave. Okay, clear? Now the second one is, obviously there is a timing. The wide QRS complex must be greater than 120 millisecond or 0.12 second, and the shorter PR interval will be less than 120 millisecond. Clear? Now the second diagnostic procedure is Holter monitor, event monitor. So this picture represent event monitor, this picture represent Holter monitor. Actually both are the ECG monitor which record your heart activity, but the question is how long they can record. So Holter monitor can record about 24 to 48 hours. Okay, but shows poor data as comparison to event monitor. But event monitor does not record continuously. Only when you activate it, it can record, and it can record up to 30 days and shows better data as comparison to Holter monitor. Okay, and obviously event monitoring is cost effective. Now the third diagnostic procedure is cardiopulmonary exercise testing. So this method used to evaluate a number of physiological parameters and conditions such as your heart lung capacities and pathophysiology, obviously, as well as physical abilities. Okay. The fourth one is electrophysiology study. This study used to evaluate your heart's electrical system and to check abnormal heart rhythm. Okay, and for this there is a insertion of catheter occurs, which is known as, this surgical procedure is known as catheter ablation. Okay, now what are the treatment? So for the treatment, obviously first choice is medication. Anti-arrhythmic medication should be provided like amiodarone, flecainide, this kind of antiarrhythmic medication should be provided. Second one is catheter ablation to measure the electrophysiology. And third one is cardioversion. This is cardioversion procedure. Okay, so these are the treatment and diagnostic procedure. Thank you for your attention.